Dear doctor, here are top 5 mistakes that you can avoid with your letterhead and visiting card. Number 1, the most important one medico-legally, is to fail to mention your registration number on your letterhead. While this is not compulsory on your visiting card, your registration number must be clearly mentioned on your letterhead, and very soon there is going to be a unified directory for all the doctors across India irrespective of their state medical council registration number. Number 2, crowding your letterhead or visiting card with too many details just to kind of avoid printing costs. Opt for a two-sided visiting card, keep your name and contact details clear, and keep your timings or locations on the other side. Same with the letterhead, keep the margins very clear and don't crowd it. Leave some space for you to write, whether it is a A4 sized letterhead or a A5 sized letterhead. Preferably do not opt for something smaller than A5, which is more like a chip block. Number 3, not making your letterhead printer friendly. With the rise in EHRs or digital softwares, more and more doctors need to print their prescription. If your letterhead is well designed and you don't have something intruding on the left margin or right margin and you have clear-cut demarcations, it is easier to print your digital prescription on your letterhead. Number 4, mentioning too many locations that you are consulting. As a consultant or as a doctor, you may be visiting multiple polyclinics or you have multiple hospital attachments. Often we have noticed that these are subject to change, both in terms of either the location or the timings, where the slot has changed or you have completely changed your consulting cabin. But then it is a challenge to keep these updated across your visiting card or your letterhead, and either there is a wastage or there is outdated information. It is better to create unified channels of communication instead of trying to mention all of these attachments. Give a link to your website and upload all of these on your website where you can edit them freely, or connect to your patients via a WhatsApp business account or any such platform from where you are in charge of disbursing the correct information to the patient and guide them to the authentic info. Number 5, overprinting. Earlier, because of the offset printing and the lack of digital printing with 1 color, 2 color printing, 4 color printing and all of those options, printers would advise us to print in bulk to save costs, whether it was 500 copies, 1000, sometimes even 2000 copies. I've known of doctors to print even 5000. Any small change, any update in degree, any update in status means either all of that goes waste or you are left with a lot of leftovers. In recent times, there are options to print just 100, 200, 500, pay per use or pay as you need kind of a feature. So opt for that. It's better economically as well as ecologically.